cardiovascular risk prevention is a central part of cardiovascular health, of course. It all starts with lifestyle modification, often initiated with counseling from a physician, but largely then the responsibility of patients themselves. Measures such as a healthy diet, exercise, weight control, that's probably the most important thing, really over the years, just to prevent multiple cardiovascular risk factors from developing. So this is really the central tenet of cardiovascular prevention and where it all starts, the real bedrock of cardiovascular prevention, which is such a big part of preventing and even treating heart disease. Implementation of cardiovascular risk reduction measures is challenging for a variety of reasons. In the primary prevention setting, that is in the setting of people without known or overt cardiovascular disease, the real challenge is convincing someone who feels well, that's without symptoms, who's healthy, that they need to do something, whether it's lifestyle modification and especially if it's medication, that there needs to be more or they'll run into trouble. And that can be a tough concept for people to grasp, especially younger people who are feeling great. And that's a real challenge in cardiovascular prevention, because we know that the risk factors for cardiovascular disease, most of which are well characterized, things like high cholesterol, high triglycerides, high blood pressure, high blood glucose, excess weight, smoking, these sorts of risk factors are well known, and some others that I didn't mention. The challenge is getting patients to act on them, because these are risks that in general accrue over decades, not over years even, and oftentimes certainly not over months. So getting patients to commit to lifestyle modification can be challenging, but is a worthwhile goal, and one emphasizing at each visit. Even if it isn't successful on visit number 1, maybe it'll be successful on visit number 2 or visit number 20. So it is important to keep trying to get patients to modify lifestyle. And that's really on an individual level I'm talking about. On a public health macro level as well, I think we've got to do more and a better job getting the word out. And part of the problem, I think, is that there's been so much conflicting advice from so many sources. For example, what is the right diet? There's so much controversy and confusion about it. And I think a better public health message would be to focus on the few things that we all agree on. Well, maybe all is even too strong there, but that most experts would agree on, that a good diet consists of a diet that's high in vegetable intake, high in fruit intake, high in whole grain intake. I would say most respectable experts in the field of nutrition would at least agree on that commonality. And perhaps even the greater overarching message there is, instead of focusing overly on exactly what proportion of the diet is from fat or carbohydrates or this or that, but the most important message is just to restrict the amount of calories to prevent weight gain, which otherwise typically will occur as one ages. So, I think there's a lot we can do in terms of individual patient encounters, but then also on a macro level to really get the word out about lifestyle modification and cardiovascular prevention. Then layered on to that, and this is more on an individual level, though I suspect there could be some public health component, making sure patients or just healthy people are aware of what risk factors there are. I would think at this point in time, for example, people would know that smoking is a risk factor for heart disease, but things change. Vaping's on the scene now. Not everyone may appreciate the risks associated with that, or the risks associated with smoking marijuana with respect to cardiovascular disease. So I think it's important to make sure people actually know what the risk factors are, and where lifestyle modification and counseling isn't sufficient, understand that there's a role potentially for medical therapy. So I think there's a lot that can occur with direct counseling of patients in terms of helping with cardiovascular risk reduction and overall preventive health strategies. I think it's also helpful to supplement those efforts with resources that are out there. And I'll just mention two, there are others as well. I think the American Heart Association, the idea of Simple 7, a concept of just focusing on the really common big risk factors and doing things that will reduce that risk. That's one terrific approach. I think the American College of Cardiology is another great resource in terms of having an online risk calculator that's useful for folks in the primary prevention and might help target or titrate whether statin therapy should be initiated. I think as well, CardioSmart is another resource from the American College of Cardiology, really geared more towards patients or healthy people as well, or their physicians or other healthcare providers. So there's a lot of resources out there, but instead of just perhaps barraging you all with many of them, I'd say perhaps focus on those two sources.